Hello friends, I am Dr. Avishek Bagchi. I am consultant cardiology from Neotia Getwel Hospital. Now there is a increase in acute sudden cardiac death amongst young people in recent past. Basically all over the world, but in India we are seeing young patients of the age of 25, 30, 35 having a sudden cardiac death. Now this sudden cardiac death amongst young can be divided grossly into two issues. One is an acute heart attack and another is an arrhythmic death. Now acute heart attack occurs because of acute blockage of an artery supplying an area of the heart. Now this is increasing because of a change in lifestyle. We are having more amount of fatty food, unhealthy food. We are not doing regular exercises. We are all getting overweight, and that is leading to this kind of an acute heart attack amongst young. Smoking is another factor. Now management of these patients is that if a young person of say 25, 30, 35 is having an acute chest pain, he should immediately go to a local hospital or a local doctor where an ECG is to be done. And if there is any changes in the ECG, he should be immediately referred to a cardiologist where proper evaluation to be done, and if required an urgent angiography followed by angioplasty is to be done, which can be life-saving in these conditions. On the other hand, arrhythmic issues are completely different issues. Patients of young age, we sometimes see patients at the age of 30, 35 suddenly dying while playing a game, while in a gym, while doing some exercises. Recently we saw a person dying out of a football match. Now there are some genetic issues, there are some genes which are responsible for this. There are some genetic syndromes such as long QT syndrome, Brugada syndrome, etc. Now these syndromes, what happens that when we exercise, there is certain electrical imbalances in our heart which leads to suddenly the heart rate goes up to 200, 300, 400 and we can die out of that. And now for management of these patients is that a baseline ECG is sometimes helpful. If we get an ECG done at a normal time, sometimes we get some changes, but in some patients, in some persons, we don't get those changes. For them, the important issue, there is a family history or not. As for example, if I say that my uncle died at the age of 25 and the cause is not known, probably I am from a family where we are carrying that gene. So this family history is important, and in those cases there are certain investigations which are to be done. Some genetic tests can be done, and for these persons, for this group of people, ICD there is a device which is advised. That is like a pacemaker, but it gives electrical shock to the heart when the heart rate goes up so high. So for these patients, ICDs are recommended. So proper screening before sports activity is important, and ECG is what we can normally do, and family history. So everyone should be cautious, because young age people are dying, and the percentage of patients dying out of cardiac issues in young age increasing rapidly in recent past, and we should be careful. Thank you everyone.